Hi, I'm Alexandra Ladd, and I'm from the University of Florida College of Medicine and UF Health Shands Hospital. On behalf of our institution, I'm going to present the topic, What is living donor liver transplantation? Living donor liver transplantation involves removing part of a living, healthy person's liver and replacing a recipient's unhealthy liver with it. The portions of liver in the donor and recipient will grow back to a full-size liver within weeks. Either the right or left lobe of the donor liver is removed and transplanted into the recipient, as depicted in the graphic here on the left. There are many advantages of a living donor liver transplant. Recipients who receive livers from living donors have better survival at 1 year from their time of listing than recipients who receive livers from deceased donors. There is increased donor self-esteem derived from actively contributing to recipient survival. There are lower inpatient costs. Livers from living donors last longer than livers from deceased donors. There is a shorter waiting time on the transplant waiting list. Recipients have a decreased severity of disease at the time of their living donor liver transplant. There is a shorter length of hospital stay, and there is less need for blood transfusions during surgery. In terms of who qualifies, in terms of the donors, these are people who are 18 to 60 years old with a healthy liver. They have an ABO blood type compatibility with their recipient. They are able to provide informed and voluntary consent. They are able to provide enough liver to the recipient with enough remaining to support their own body. Their liver anatomy is suitable for transplantation based on CT or MRI imaging. In terms of the recipients, these are people who are suffering from chronic liver disease. For example, liver cancer or liver failure. Living donor liver transplantation has some risks. In terms of donor risks, there is a 5 to 10% chance of surgical complications, with mortality less than 1%. In terms of recipient risks, there is a risk of liver graft failure, which would necessitate retransplant. Bile duct complications are anywhere between 15 to 60% for both donor and recipient. However, these complication rates decrease with center experience. Thank you.